This presentation will take you through the main characteristics of the syndrome, early years development including motor skills and speech and language, cognitive abilities, dietary needs and management, health concerns including unusual features of the syndrome which may have health risks, working with children with PWS including helping the child reach their best potential and behaviour management, guidance on what reasonable adjustments you might make to enable the child to access every area of the early years foundation stage. Transition to primary school. The characteristics of PWS. PWS is a genetic disorder which involves missing information from the paternal chromosome 15. We know that several genes are involved, and researchers are getting close to identifying which of those are actually the cause of PWS. It affects people for their whole lives. It is not a disease which children grow out of. For further information about genetics in PWS, visit our website. Our estimate is that there are probably no more than 2,000 people with the syndrome in the UK, of whom we are in contact with about 1,200. About 500 to 600 of these are children aged 18 or younger. We estimate that around 30 to 40 babies are born each year in the UK, so it's hardly surprising if you've never come across PWS before. It affects all races and both sexes equally. Life expectancy is increasing, although obesity can claim lives at a very early age. With good management, people are living well into their 50s and 60s. PWS is now diagnosed through a genetic blood test, but there are clinical features which also define the syndrome. These are hypotonia or low muscle tone. Babies are born very floppy. They have little or no sucking ability, so are usually tube-fed for the first few weeks or months of life. They have a very weak cry and appear very undemanding. They often sleep for far longer than other babies. The low muscle tone continues throughout life and can affect physical development and speech. Growth hormone is now licensed for children with PWS, and it helps with both low muscle tone and short stature. Not every child has this, as tests have to be carried out to ensure it is safe and appropriate for the child. Also, some parents prefer that their child does not receive growth hormone treatment. Where it is given, treatment can start as early as 6 months old, more often around 2 years old, and, if it proves to be beneficial and without any side effects, can continue to be given until the child reaches 18 years old. Hypogonadism or immature sexual development. This is usually detected in boys from an early age, as they usually have smaller than average genitalia and undescended testes. It is present in girls, but not so evident. Distinctive facial features are also evident, particularly in those who have the deletion genetic type. These are often described as almond-shaped eyes, downturned mouth, and a narrow forehead measured between the temples. Many deletion-type children also have fairer colouring than their parents. These features are not so evident in those with other genetic types of PWS. Many children also have very sticky or viscous saliva, which is evident in crusting at the sides of the mouth. This can impact on the ability to chew and swallow, and also on speech. Check with parents if this is a problem and if the child is receiving any treatment for it. Hyperphagia or excessive appetite is one of the most difficult aspects of the syndrome. It usually appears around the ages of 2 to 4 years old, when the child becomes increasingly interested in food and may begin to act as if they are continually hungry, for instance, searching for food. For some, this aspect of the syndrome may not appear until they are older than this. Lack of social skills and communication difficulties can be seen from an early age when compared with children of the same age. There is a distinct set of behavioural characteristics or behavioural phenotype which tend to go alongside PWS. The range of intellectual ability in PWS is wide. While most have mild to moderate learning disabilities, some have no learning disability, and there have been recorded IQs of 100 and over. A few have more severe learning disabilities. We will be discussing all of the above later in the presentation, but to find out more about the clinical aspects of the syndrome, visit our website. Nutrition. Each child with PWS develops at a different rate, as any child does. The following information is of a general nature, so do not be surprised if the child you are looking after follows a slightly different pattern to what is set out here. Weaning depends on the ability of the child to swallow and digest solid food. Some take longer to develop this than others, and may be tube fed for several months. Parents and/or medical consultants can advise on this. If you would like to know more about the phases of development with regard to nutrition, Dr. Jennifer Miller from the USA has produced a very good article that you can access online. Milestones. Because of the low muscle tone, both fine and gross motor skills may be delayed. The children may need special equipment such as a standing frame or specialist seating. The average age for alertness and responsiveness is 6 months, for crawling 16 months, for walking 28 months, and for speaking more than 10 words 39 months. However, it must be noted that this is an average. Some children with PWS will reach some of these milestones earlier or later. Often too, the crawling stage is missed out, with children preferring to roll or shuffle on their bottoms before standing and walking. Toilet training appears to be very individual in PWS, with some children learning this quite early on, and others taking much longer. Even if the child is no longer in nappies, it is likely they will still require support with personal care and hygiene. In some children, the low muscle tone means that they are not aware of the need to go, or can become constipated. The differentiation required for a child with PWS fits in with the early years foundation stage framework, unique child theme. We will be discussing this in greater detail later in the presentation. Speech, language and communication. It is not uncommon for speech to be delayed, even when other milestones have been reached. Some children have a greater level of understanding than their speech would indicate. However, others may be quite articulate, but their comprehension levels are lower. Check that information has been processed and understood. Various speech and language problems have been diagnosed in children with PWS, such as dysarthria and dyspraxia, but each child is an individual in this respect. The help of a speech and language therapist should be sought if there appear to be significant speech problems. Makaton is often used with small children with PWS to help them communicate. You can find more information about speech and language on our website. Cognitive abilities. As we mentioned before, there is a wide range of ability in PWS. Some children with PWS will show little difference, if any, in their cognitive abilities from other children at this age. They may begin to show an interest in looking at books, but may struggle with some counting activities. In common with most of the children, those with PWS like to have visual reminders and prompts about activities. Processing information may be a little slower than in other children, and they may need extra time to understand what you've said or shown them. Many children are very able at doing age-appropriate jigsaw-type puzzles and enjoy creative work. Some children show characteristics of autism spectrum disorder, such as wanting to do things in a certain way, repetitive behaviour, or having a lack of social skills. This becomes more evident as the child gets older and may be related to immature emotional and social development, rather than true autism. However, if this is suspected, professional advice should be sought. We will be discussing more about helping children with PWS to make the most of their abilities later in the presentation. We will now go on to talk about the dietary needs of children with PWS. We all have complex mechanisms in our bodies which alert us to when we need to eat, one of the most basic needs for survival. In PWS, it appears that messages from the stomach are not reaching the brain to let it know that enough has been eaten. Basically, someone with PWS continues to feel hungry even after they have eaten an adequate amount of food. To understand how this affects someone with PWS, here is a little exercise for you to think about. Imagine that you are really hungry. You missed your last meal. There is a buffet set out at the back of the room, where you are listening with other people to a speech. You have been told that the buffet will open after the speech, but you do not know how long the speech will go on for. It seems to be going on for a very long time. Think about how you would feel. What would you do, or how would you behave? You probably felt that the food would be a distraction to you, and you would not be able to give the speech your full attention. You might decide to get some food, even though the buffet is not officially open yet. You may become irritable. All of this happens on a daily basis to people with PWS when food is within sight, smell, or reach. The environment around the child, therefore, needs to be managed to ensure only an appropriate amount of food is eaten, and that it is not available when it is not a meal or snack time. Dietary needs and management. Once the failure to thrive phase has passed, most children with PWS will require fewer calories in their daily diet than other children. This is because of their low muscle tone, even if they are on growth hormone. Parents should have received information about the amount of food their child needs from their dietitian or other medical consultant, and the child's weight will be monitored by these professionals. The child in your care may or may not have begun to display the excessive appetite and consequent desire for food, which is typical of the syndrome. In some children, this appears much later than others, and it may not be something you have to worry about. Good communication with parents is vital to ensure that measures are put in place if the child displays or begins to display an excessive desire to eat. Parents will also be able to advise on an appropriate diet for their child. Different families follow different diets, so communication and a food plan is vital. It is also very important that everyone working with the child respects and applies the measures which are in place. One weak link, which could be just someone who likes to give treats or extras, can undo everything everyone else is trying to do, and will send mixed messages to the child, which can be very confusing to them. By environmental controls, we mean looking at the environment around the child. If meals are provided, how easy is it for the child with PWS to get food from other children's plates? Do other children have sweet snacks? If so, can a healthy eating policy be introduced for the whole nursery? What happens at birthday parties and outings? How can you ensure that if there are treats, then these fit within the child's usual diet? Once again, it is essential to liaise with parents over this about the regime they would like you to put in place. Often it is possible to give extra treats if the child is aware that they may have a little less to eat when they get home. Or use alternatives, for example fruit presented in a special way, rather than cakes and cookies. Many children love playing with play kitchens and pretend food. It is important to check that they are not eating pretend food or food-like items such as Play-Doh. Many nurseries use food as part of sensory play, for example, oats or pasta. Again, make sure that adequate supervision is provided in these circumstances. Health concerns. Children with PWS are generally healthy, though some may have medical problems such as scoliosis, curvature of the spine. It is important to obtain a full medical history from parents. They are likely to have the usual childhood illnesses, but these are rarely problematic. We have no reports of side effects occurring from any of the usual child vaccination programs. Low muscle tone means that some children find it difficult to rid themselves of phlegm, which has resulted from a cough or cold, and can mean chest infections go on longer than usual. There are several unusual risk features in PWS which require special attention and monitoring. Many children with PWS have a high pain threshold and will not register pain. It is therefore very important that they are checked over thoroughly if they have had a fall, and if any problems are suspected, taken to a doctor or A&E. Equally, some children may suffer stomach problems, diarrhea or constipation without complaining of pain. Another common feature in PWS is the lack of vomiting reflex caused by low muscle tone. As most children are often physically sick if they have something wrong, the fact that this has not happened to the child with PWS can mask the fact that they are in fact ill. Some individuals have a base body temperature which is slightly lower than normal. It is important to know what the child's usual body temperature is and record this. If it is usually lower than normal, a rise in temperature to slightly above normal could be equivalent to a high temperature in another child. Many children also have difficulties distinguishing if they are too hot or too cold. Easy bruising is also quite a common feature of PWS. Because of the high pain threshold, a child may not be able to say how they came about the bruise, so it is important that falls, etc. are monitored and parents let you know if there have been any falls at home. There is a risk of choking, particularly if the child eats very fast. Check with parents about the child's medical history and whether or not their child displays any of the above risk features. You may have no need to provide any emergency information to professionals, but should this happen, you can direct them to the PWSA UK website, where they will find information for hospital and A&E staff. Ensuring the right environment. Children with PWS are usually very affectionate and friendly at this age, and you will find that working with them can be very rewarding. One of the key factors in helping them develop their potential is to ensure that the environment is right. In fact, in this respect, their needs differ very little from those of other children at this age. Food security is very important, and a routine should be established whereby it is only available at set times and is not in sight for the rest of the time. Keep food out of sight and, if necessary, locked away when it is not snack or meal times. Clear food away promptly. If not already in place, consider a healthy eating policy for everyone at the nursery. Children with PWS work better in a calm and uncluttered environment. They find it difficult to deal with chaotic environments. Some children with PWS have mobility problems and may need help to reach play resources. Equally, they may find the variety and choice on offer is overwhelming. Support these children by offering 2 particular choices at a time. Daytime sleeping is one of the common features of PWS, and children with the syndrome may tire more easily than others. Make sure there is a quiet space available for them to rest in, if need be. You should also ensure that there are lots of visual prompts around to help the child's understanding. Communication. The usual ways of communication with children at this young age also work well for children with PWS. Talk in a clear, simple, direct manner. Check that the child really has understood what you say. Sometimes it will appear that they have. For instance, if you say, "Did you understand that?" they will say, "Yes," whether they did or not. Use simple choice questions. For example, say, Do you want to do colouring now or play with the building bricks? Not, what would you like to do now? Repetitive questioning or perseveration is often a stage which many young children go through, repeating why to everything you say. Children with PWS are likely to carry on doing this as it is not a phase they will necessarily grow out of. Help them limit this by letting them know that you will only answer a question one more time, or by indicating a visual prompt. Questions will often centre around food. Phrase your speech in a positive way. For example, say, "Please shut the door," not, "Don't leave the door open." For children with articulation problems, Makaton can be a very helpful way to ease frustration caused by the child's inability to communicate their needs. Tantrums. Tantrums are very much expected in all children from ages 1 to 4. Those with PWS are no different, although the tantrums or outbursts may continue into adulthood. It results from an inability to control emotional responses to situations which happen when the child cannot get their own way. The methods of dealing with them are very much the same as for other children. If possible, remove the child to a safe, calm space. Speak as little as possible, but present a calm attitude. Do not raise your tone of voice, cajole or threaten. Wait for the child to calm. This may involve having a rest before asking them to rejoin other children. Do not give in to demands. This is particularly important in PWS because the child will learn that they can get their own way by having a tantrum. Children with PWS have a great deal of potential which you can help them to unlock. Like other children, children with PWS work well when they can look forward to rewards for completing tasks or improving problematic behaviour. Smiley face or star charts work well, where the reward is given when a number of stars are achieved. Only in exceptional cases, and only with the agreement of parents, should you use food as a reward. Other rewards you could use are toys or using a favourite piece of play equipment. This also works better if other children do not receive food rewards as well. They respond very well to humour, particularly of the visual type, and this can be used to distract from potentially distressing situations. Children with PWS sometimes find it difficult to develop appropriate social skills, even though there is a desire to make friends. You can help with this by giving extra support when playing with other children. Like many children at this age, children with PWS find it difficult to adapt to change and can be very upset by it. Whilst most children learn greater adaptability as they get older, children with PWS often do not. Help them deal with change by giving visual prompts and allow time for them to process information. Behaviour management strategies used for children with autism spectrum disorder can often be used when working with children with PWS. When a child diagnosed with PWS comes to your setting, the SENCO will need to put in place a plan which will enable the child to access every area of the early years foundation stage and progress within it. Some settings merge the care plan with an individual education plan. Others separate next steps from management and care. The child's needs will change over time, so the plan will need to be regularly reviewed and updated. Who should be involved? Parents and carers. These are the primary educators and managers of their child and will be able to share information about their child's individual needs. Where a child is cared for by the local authority, foster parents and the child's social worker will need to participate in the plan. Other professionals. A baby or child with a diagnosis will probably already have involvement with a paediatric consultant, dietitian, speech and language therapist, health visitor, physiotherapist, occupational therapist and others. They will all have given parent carers advice and strategies, and so these need to be included in the plan. All nursery and preschool staff. Everyone will need to have knowledge of the plan and adhere to it. Staff development will be needed to ensure all adults who come into contact with the child understand the syndrome and understand their role in the management of the plan. Management Committee Governors. For a plan to be effective, it must be endorsed at a managerial level. Other parents and children. It is up to the parents, carers to decide how much, if at all, they would like their child's peers and the parents to be aware of their children's condition. Some families welcome the opportunity to raise awareness and inclusion. Other families do not yet feel that confident. The discussion requires tact and sensitivity. What should be included in the plan? Prime areas. It is likely that reasonable adjustments will need to be made to allow the child with PWS to access all areas of the EYFS in your setting. To do this, look at the statements in each area of learning appropriate to the child's age and ascertain what changes you might make to enable the child to achieve these statements. The prime areas of personal, social and emotional development, physical development and communication and language development should be prioritised. Adjustments may result in amendments to policy, the physical environment and practice. Policy. It is a statutory requirement to have in place an SEND policy. This is an opportunity to create or review the nutritional policy. Children with PWS require a low-calorie, low-fat diet. Review your menus, portion sizes, the use of food as treats, cookery classes, sharing of food and access to food in your setting in relation to the child's needs. Environment. Because children with PWS generally have poorer muscle tone, coordination and sustainable energy than their peers, review how you carry out physical play sessions, the accessibility of gross motor and fine motor equipment outside and in the classroom. Consider the accessibility of furniture, play, learning and toileting locations, and everyday classroom equipment such as mark makers, cutlery and scissors. Practice. Because children with PWS often have trouble dealing with change, it is best practice to use a visual timetable and signal a change of event, for example, tidy up time, with eye contact, the child's name, and a photo or image of what will happen next. Many children with PWS have delayed and unclear speech. The use of Makaton signing is a very useful tool to support both communication and inclusion, as its practice is widespread amongst families in which there are children without additional needs. As all children with PWS are different in their abilities, it is not possible to give specific information about each child within this presentation. It is therefore important to gain as much information as possible from parents before their child joins your nursery. This would include how the child sits and stands. Do they crawl or walk? What support is required? Can the child grasp objects? Are some objects more difficult to grasp than others? Information about diet and the dietary regime, for example, what should be given for snacks and lunch. If a dietitian or other consultant is involved, ask to see a copy of the information about diet that they have provided to the parent. Are there any additional physical difficulties? This can include speech, vision or hearing, but also difficulties related to scoliosis, limb abnormalities and so on. Can the child tolerate touch, messy hands, noise, etc.? If not, there may be an additional diagnosis of autism spectrum disorder. Note though that many children have acute hearing and so very loud noise is not very well tolerated. Difficult behaviour can often be triggered by certain words or actions. Parents will know what these are and can tell you what to avoid. Make sure you get contact details and any relevant information from key professionals who are involved with the child. And how do parents feel that PWS affects their child? The information we have provided in this presentation can only be a general overview. At this age, the symptoms of PWS can vary considerably, so it is important to gain insights from parents as to how much they think their child is affected. Moving to primary school. Because of the range of abilities in PWS, and because it is often difficult to determine how a child will develop intellectually, parents often find it difficult to choose which type of primary school their child should go to. PWSA UK recommend that all children with PWS should have an EHC plan, even if they appear to be of average intellectual ability. The other complexities of the syndrome mean that they are likely to require additional support throughout their school lives. Most young children with PWS start their school lives at mainstream primary, often with additional support. As we have mentioned before, many children with PWS find change very difficult, but at the same time, if too much information about change is presented, or too far in advance, they are likely to become very anxious. They will most likely need to visit their new school and, if possible, meet their new teacher more than once. Make sure the new school has as much information as possible, including triggers which cause upset, how the child deals with food, and potential risk factors. PWSA UK are the only charity within the UK providing the support, advice and information that is so vital to our families. Please help us to continue to provide this support by holding a No Treats for a Week fundraiser. Our easy-to-use pack provides all the tools you will need to hold this fun and easy fundraiser, whilst also teaching some basic facts about healthy eating and Prader-Willi syndrome. Either download all the information you need directly from our website or ring the office on 01332 365 676 and speak to Karen. We hope you have found this presentation useful, and we welcome your feedback if you feel it could be improved in any way. For more information, visit these websites or contact us. We will be pleased to help answer individual inquiries. We also facilitate a Teachers Network, an email circulation list for teachers of children of all ages to ask questions and to share experiences and good practice. PWSA UK would like to thank Genes for Genes for a grant towards this project, parents of children with PWS and nurseries who have shared their experiences.